So I've been asked to talk about how does a patient make the decision to say when they're ready to have a joint replacement. And when I say joint replacement, I typically am talking about knee and hip replacements. Those are the ones that I do. But I do think that this will also apply to folks thinking about shoulder or ankle or other types of joint replacement surgery. Um, when someone comes into my office and we sit down and we start having a conversation about their situation, I think of it sort of like there's a checklist, and we have to kind of go down the checklist with the patient to see, well, okay, are they appropriate? First of all, do they have the appropriate problem that we could help them with a joint replacement? And have they tried an appropriate amount of conservative management? That could be something as simple as using some ibuprofen and doing some exercise to adjusting activities. And we'll speak about all of that. The patient has to be medically appropriate. They have to be healthy enough to have such an operation. And not everyone is. Most patients are, certainly, but not everyone is. And then I try to assess how comfortable the patient is, both in terms of how much pain they're having and how much loss of function they have, but also how comfortable are they with the decision, because it is, a decision that you can't come back from. Once you've done the surgery to put metal and plastic and ceramic parts in a knee or a hip, then that cannot be undone. So it's really important that the patient be comfortable with that decision, and also comfortable with their interaction with me and on every level. And I think that's really important. So achieving that comfort level for the patient, I think we have to have this thorough discussion to make sure that they understand what the problem is and what their options are, and then the solutions we have to offer. And in the end, I always explain to them that these surgeries are not surgeries that we undertake lightly, but that ultimately they are elective, meaning that the patient has to make a personal decision about whether or not it's the right move for them.